It's PE class, and these kids at Thompson Middle School take to the court for a game of basketball. But for one of these students, his greatest opponent is type 1 diabetes and its serious complications.
We noticed stomach aches here and there, sporadic throughout probably the last couple of months, and headaches.
Shay Kinsey's parents also noticed him drinking lots of fluids and frequent urination, clear signs of type 1 diabetes.
It is an autoimmune disease that attacks the pancreas, and the cells that create insulin are damaged and no longer produce insulin,
which is a hormone that enables you to get energy from food. Despite diabetes, being normal and active like other 12-year-olds is Shay's way of life. The Kinseys adopted at Children's of Alabama Hospital. Shay learned to care for himself, including injecting insulin.
When he's doing the athletics, like playing a soccer game, he's got to check his sugar before, check his sugar during, and check his sugar after every 2 hours.
Do you know what you're going to eat?
Yes, pizza, queso on rice.
Shay must routinely count the carbs and watch his blood sugar level because there's a rare, dangerous component to his diabetes. It's called hypoglycemic unawareness, which means he's unaware of low blood sugar symptoms.
That particular person is not sensing their tremors anymore, and therefore they are unable to detect their blood sugar before the effect on the brain happen, to worry about getting dangerously low blood sugars below 40 without knowing about it.
If you get too low, you can go into coma.
Let's say till he gets to 50, if it's dropping rapidly, he could literally just be talking to you and pass out.
Teachers are really good about picking up signals from the children. He may not be able to feel a difference, but they may find it in his personality, the way he's acting, the way he's looking.
The school nurse, along with Shane, check his blood sugar level before PE, before lunch, and before he leaves school. Shay says diabetes is just part of his life.
It sucks sometimes, but I fight through it a lot of times.
Good news, Shay now has an insulin pump. He went through extensive training for it at Children's of Alabama in August.
It's given me insulin, of course.
It gives him a little more freedom to eat pizza or something a little more high carb than what he was eating before.
Like if I had 68 carbs, the pump would divide that by 29 and then give me all that insulin.
The correct needed dose based on his carbs intake. Freedom to live life as normal as possible on and off the basketball court while facing the ups and downs of type 1 diabetes.
He does have what we call our pity parties where, diabetes is not fair, it's not fun, which we have to agree because there's nothing, there's no cure.